Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test,
minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1.
Hello, Rebecca. How are you today?
Dr. Miller, I'm still having problems holding my urine until I get to the bathroom. I'm leaking before I can make it to the toilet, so I've been wearing these bulky pads. I have to wear them. My desk is at the other end of the office, far from the bathroom.
I see. Well, the last visit you said that you are not leaking urine when you cough, sneeze, exercise, or lift something. Has that changed?
No, I don't leak at those times. I'm just feeling this urgency to go and rushing off to the bathroom 10 or 12 times a day. It's a nuisance because I'm so busy at work these days.
Well, we've ruled out bladder infection and other bladder problems. It seems that you have a type of urinary incontinence called urge incontinence. It affects women across all age groups. Likely the muscles that you use to hold your urine are weak. Well, the good news is that there are treatments that work to help you to become continent.
Continent?
Continent, being able to hold your urine until you go to the bathroom. And even if you aren't continent 100% of the time, treatment can mean fewer times when you leak urine by accident.
That would be nice. How is this treated?
Well, there are quite a few non-surgical treatments for urge incontinence. Some lifestyle or non-drug treatments include bladder training or a medical device called percutaneous tibial nerve stimulation. Then there are medications.
There are a lot of choices. Could you go over the options?
Sure. With the bladder training, you hold your urine for longer and longer amounts of time.
I see.
With nerve stimulation, a thin needle is inserted near your ankle. Pulses of electricity stimulate the nerves in your leg that connect to the nerves that control your bladder muscles. And prescription medications can reduce your incontinence or eradicate it completely.
It's a lot of choices. I'm just not sure. What do you think I should do, doctor?
Rebecca, people with urge incontinence get results from all the treatments I just mentioned. But since you're busy at work and the bathroom is so far from your desk, for now, I'm going to prescribe a medication to help you with this problem.
A prescription? Well, I guess I could give that a try.
Now, I want to see you back here in about a month. Call me sooner if you're experiencing side effects from the medicines or finding that you want to do something else. I think we can get this thing worked out for you.
Hello, I'm Julian, one of the nurse practitioners here. How can I help you?
Well, Julian, I've got some pain in my sort of the lower part of my tummy, actually.
Right. Okay. And have you noticed any other symptoms apart from that abdominal pain?
Well, the pain's there sort of on and off, but then when I have a wee or go to the loo, it really hurts.
Right. Oh, it hurts when you go to the toilet. Right.
Yeah.
Okay. And how long have you had that abdominal pain for?
I think it's been about a week, really.
Right.
Sort of on and off, not all the time.
For about a week. Okay. What about the pain when you pass urine? How long has that been for?
I suppose towards the end of the week, and then really over the last 3 days, that seems to have got worse.
Right.
And now it feels like if I, as soon as I need to go to the loo, I've got to go. I feel like a real urgency to go, and it seems like I'm going to the toilet more often.
Right, okay. So some pain passing you in the last few days, and then more recently had to go to the toilet more often, and you feel like you've got to go all the time.
Yeah, and in the night I now have to wake up and go to the loo.
Right, you have to get up at night as well, okay. All right. Have you had any problems like this before, this type of urinary problems?
I suppose I had something sort of similar, about 2 years ago actually.
Right.
And it sort of felt quite the same.
Right, and can you remember what that problem was?
I think they said I had cystitis.
Right.
Yeah, cystitis, and I had to have just some antibiotics.
Oh, some antibiotics, okay. And did it go away then?
Yep, it went away, and I don't think I've had anything since.
Right, okay, fine. Have you still got the abdominal pain at the moment?
Yes.
Okay.
Not too bad.
Not too bad.
But it's there,
Okay.
it's just sort of in the background.
Okay, is it there all the time, or does it go up and down?
I think it goes up and down really, but worse perhaps when I am having a wee.
Okay. On a scale of 1 to 10, with 10 being the worst, how would you rate the pain?
It's not that bad, I think it's probably about 4.
About 4?
3 and 4.
Okay, so not so bad. Okay. Have you taken any medicines at all for this problem?
Well, I did take a couple of paracetamol,
Okay.
and that seemed to help with the pain, but obviously it doesn't stop me needing to go to the loo all the
Right.
time.
And it helped with the pain a bit. Okay, good. All right, now I just wanted to ask about some other symptoms related to this. Have you had any fever at all, like feeling hot?
No.
No. Have you felt sick at all? When you vomited?
No.
Okay. Have you noticed any blood in the urine?
Oh, no.
No? Okay. That's
Should
good.
I?
Well, if you did, then we'd want to do something about
no.
it. If you haven't, that's fine. Okay. And have you noticed any unusual vaginal discharge at all?
No, just the same really.
Just the same, okay. And any unusual vaginal or vulval irritation or spots or sores since you've had this problem?
No, just the sort of pain that feels like it's inside when I'm having a wee, but I haven't noticed anything. So.
Okay, fine. Okay, and do you have a partner at the moment?
Yeah, I'm married. Been married 5 years nearly.
5 years, okay. Right. When did you last have a sexual health screen?
I think it was, before we started going out with each other, so as we were going out, which is probably about 6, 7 years ago.
Right, okay. All right, fine. And I need to ask this question in relation to possibility of sexually transmitted infections, but have you had any other sexual contacts
No.
recently?
I haven't.
No. Okay.
Oh,
Well,
maybe my husband has.
okay. Well, we're just checking to see if there's any risk for sexually
I don't
transmitted
think so.
infections. Okay, that's fine. And I just need to ask about your period as well. When was the first day of your last period?
What day is it today? About 2 weeks ago.
2 weeks ago. Okay, was that as normal, do you think?
Normal.
Okay. Do you
No
think there's
problem.
any risk of pregnancy?
No, because I have an implant.
Right, okay. Fine, okay. That's all right. Now, so how often would you say you're going to the toilet during the day?
Oh, it feels like I could go every 5 minutes,
Right,
really.
right.
I don't know.
Okay.
Quite more than I would normally go.
Right, okay. And have you been able to go to work, or you've had to take time off?
Well, since it's now feeling like I might wet myself if I don't get to the loo
Right.
quick enough, I've taken the last 2 days off.
Right.
just because I work in a really busy office and I can't bear the thought of that happening at work.
Okay, fine, all right. Okay, so you've mentioned that you've had cystitis before in the past and you had some antibiotics for that.
Yeah.
I just want to ask about some past medical history problems. Have you any other illnesses or operations in the past that I should know about?
No, nothing really. I've always been really healthy. I mean,
Okay.
I had this sort of cystitis thing 2 or 3 years ago. But
Okay.
other than that,
All right, fine. Okay, so I just wanted to ask about medicines as well. You mentioned that you're taking paracetamol
Yes.
for this problem and that you've got an implant as well. Do you take any other medicines?
No, I mean, sometimes I might take ibuprofen if I needed
Right.
to, but nothing regularly.
Okay,
No.
fine. And are you allergic to any medicines
No.
you're aware of?
No,
No. Okay.
not that I found out.
Fine. And what sort of job is it you do?
Well, I work in an office, but I'm just a secretary.
Right, you're secretary in an office. Okay.
Mhm.
And you're married?
Yeah.
Have you got any children?
No.
No. Okay. All right. And just thinking about your weekly alcohol intake, how much do you think you would drink normally?
Not very much really. Probably a couple of glasses a week.
Right.
Sort of just depending on what's going on, but most weeks probably minimal.
Right. Okay. Okay. Good. And what about smoking?
Well, I've been really good. I
Yes.
used to smoke.
Oh, okay, yes.
I think 3 years ago now I stopped and I haven't smoked
Right.
since.
Okay. Oh, that's good. That's good. Well done. Okay. And what about exercise? You take any exercise?
On a Monday night after work I go swimming.
Yes.
And I do walk my dog
Right.
2-3 times a
Okay.
day.
Yes, that's good.
But nothing else.
All right. That sounds okay. All right. And have you had any travel anywhere recently, say outside of the
No.
UK?
We're going in a couple of months, but we did actually go. I think our last holiday we just went to Ibiza last
Right.
summer.
Okay. Fine. So nowhere exotic, really.
Trading.
Okay. And what were you thinking this problem might be? Did you have any
Well,
thoughts?
It seems very similar to what I had a couple of years ago, really. So I think maybe I've got cystitis or a urine infection.
Oh, right. Okay. Yes, it does sound a bit like that, doesn't it?
Mm.
Yes. Okay. And what were you thinking to do about the problem today?
Well, as it worked so well before when I had the antibiotics, I thought maybe I should have some antibiotics because it doesn't seem to be getting better.
Yes.
It's getting worse, really.
Okay. Fine. All right. Okay. Well, I think that's the end of my questions I want to ask you. So that was the end of my history taking station. So I'm just going to switch the video recorder off.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen.
Anne Greenall is undergoing an asthma screening, interacting with a respiratory therapist despite the fact she can't hear a thing. She doesn't have to. A translator is bridging the gap.
I'm able to communicate effectively with hearing people.
The Americans with Disabilities Act requires hospitals to provide effective communication for the hearing impaired in all healthcare settings. It doesn't mandate a method, but computers can't compete.
Of course, there's a lot of technologies out there, but you cannot eliminate the face-to-face.
So you haven't had to use that?
No, I haven't used it.
It sets the patient at ease, and it sets the patient care provider at ease, because Lee Memorial Patient Care Team really wants to make sure that the patient leaves fully understanding their care.
Communication being a two-way street, the translating works both ways, giving health information to the patient but also getting feedback in return. In that way, doctors and health professionals can hear the patient's questions and concerns.
We consider all the people that we work with are deaf consumers. So not only when we come into a situation, hearing people are also people that we're interpreting for.
Anne is all smiles at the end of her appointment. A potentially stressful situation is translated to a pleasant experience.
Let me help you get these slippers off. You did a great job on that walk.
You sure did, Ms. Adams. How are you feeling?
Well, I'm kind of glad it's over. It will get easier, won't it?
Oh, it will, hon. It will.
That's what we're working towards. So if you both look at the board here, it's spelled out. Mr. Adams, I'm really glad that you're able to be here when we're walking with your wife, because I think it's going to give you a better sense of what to expect once you're home and how her recovery is progressing.
Oh, it certainly will.
Now, we gave her the pain medication an hour before she walked so that she would feel comfortable. Then, as you saw, when we got her out of bed, we had her sit on the edge of the bed to make sure she wasn't dizzy from the medications. Then we had her stand for a minute to make sure she was okay before she started walking. That's going to be important to continue once you're at home.
Uh-huh.
And we also talked about how it's important for Ms. Adams to get all of her medications on time at home. She's on a blood thinner to prevent blood clots, and walking also keeps her blood circulating and will prevent clotting as well.
Yeah, I really like that little calendar you showed me that has all the times charted out. But, you know, I'm not sure either one of us is clear on the dose of each medicine.
He's right about that.
I'm really glad you told me this. This is exactly the kind of information I need to know. I'll go over the doses now, and we'll review them again when Ms. Adams is discharged. Plus, I have some printed materials to give you when you go home as well.
Thanks. That'll be really helpful.
Today, we're trying to understand and feel confident and competent when providing care for young patients who exhibit anger or aggression. Aggressive behaviors bring the potential for harm. Concern about this is legitimate, It's perfectly okay to be on guard and careful when someone poses a risk. The key is to push through our apprehension, to manage the situation, as well as to provide good care. This kind of behavior in children is sometimes surprising, and many times the intensity and the child's capacity for strength is alarming. In this module, we want to look at two elements of managing these behaviors. First is understanding the underlying reasons why the child may be behaving this way.
Hello, how may I help you?
I would like to make an appointment with Dr. Smith, please.
What would you like to see him for?
I need my annual physical and also have a shoulder problem. It is aching.
Dr. Smith has openings next week. Are you free on Monday or Tuesday?
I am free on Tuesday afternoon.
We will schedule you for next week, Tuesday at 3 p.m. Hi, doctor. I came today because I need a flu shot and to get a checkup.
Okay. Have you had a flu shot in the past year?
No, not in the last few years. My knee hurts as well. I have been running a lot more and think it is injured.
When did the pain start, and does it still hurt now?
About 2 weeks ago, and yes, it still hurts.
I suggest you ice it, and I will prescribe you some pain medication.
Thank you, doctor.
Hello, I'm here to visit my sister. What is your sister's name? Her name is Antoinette Simmons. She is going to have a baby.
Oh, congratulations. Yes, I see here Miss Simmons is in the maternity ward. Do you need directions?
Hello, I'm here to visit my sister.
What is your sister's name?
Her name is Antoinette Simmons. She is going to have a baby.
Oh, congratulations. Yes, I see here Miss Simmons is in the maternity ward. Do you need directions?
Yes, please.
She is in the East Wing. Take this elevator to the 3rd floor and walk down the hall, then make a right turn. She is in room 304.
Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
The way that we teach clinical history taking at Warwick Medical School is to use the 4 frames. And the 4 frames are a logical way to take a comprehensive history and not miss anything out at all. So the first frame is a presenting complaint and the history of presenting complaint and the systems review and the red flags. So we encourage our students to ask an open question so they can start eliciting the symptoms from the patient. Then we would click into one system. What I mean by that is that if somebody has chest pain, for example, then you would clearly need to ask about all the cardiac symptoms once you've got a lot of detail about the patient's pain using a mnemonic such as SQUITAS, which is site, quality, intensity, timing, aggravating factors, relieving factors, and associated symptoms. I think then it's very important to ask about other systems. So we would do a systems review and then finish off by recapping the red flags. That is, for example, blood anywhere, lumps and bumps anywhere, weight loss, change in appetite, change in bowel habit. The next frame could be the past medical history. We'd ask about operations, any other significant serious conditions. They would ask about the drugs because they would often be related to the past medical history. And they would ask about over-the-counter drugs as well, and also check on recreational drugs. We will then move on to check allergies and food intolerances. With respect to allergies, it's very important to ascertain whether the patient has any allergies such as to penicillin and what the nature of that allergy or reaction is. The third frame is a social history. So we'd explore the patient's social history, we'd find out how these patient's symptoms and conditions are impacting on the patient's life and occupation. We'd also need to inquire about smoking, alcohol, home circumstances as well, and occupational factors. We would also then need to move on to the family history, particularly in relation to the presenting complaint and other serious conditions that could run in the family, such as cardiovascular disease, hypertension, or diabetes, or even asthma. The final frame is to explore the patient's values. Why is the patient worried about their condition? So there we would need to explore the patient's ideas about what they think is going on, what concerns them most, and also to ask them about their expectations of how we can best help the patient. Then there should be an opportunity at the end to let the patient ask you further questions, but also if there's any bits of information that they would like to give you. Then usually at the end, it's a good idea to recap the main features of the history back to the patient just to check that you've got all the main facts. And then you could move on to a discussion about the management, which would include an explanation of what's going on, investigations, and follow-up.
which comes from Mel, who asks if soy milk is messing with our hormones and if there are healthier milk alternatives. We're joined by Olivia Willers.
Hi, Michael.
A lot of us tend to think of soy milk, live as a healthy option. You can find it in the health food aisle of many major supermarkets. What's it actually made of?
It's funny, a lot of us do tend to think of soy milk as, and I guess any other kind of plant-based milk as a healthier option or a health food. And it's certainly a lot of reason that people make the switch now, not just because they're, lactose intolerant or maybe they want to reduce their carbon footprint. But soy milk, it's essentially made from soybeans and filtered water. So it's kind of taking the milk from soybeans that have been pressed, or in some cases, manufacturers will use a soy protein powder. And then they add in things like oils and sweeteners and salt to get it to that similar kind of consistency and flavour as cow's milk. And it's also normally kind of fortified with calcium and vitamin D and certain B vitamins, just so it becomes a good, substitute for cow's milk and a good source of calcium.
Okay, so how does it compare nutritionally to regular cow's milk?
Well, nutritionally speaking, it's pretty on par. Soy milk that's fortified is fairly similar to dairy milk, and that's most of the soy milk that we'd find in the supermarket. There's no reason why anyone needs to have dairy milk or cow's milk, but it's certainly a good source of protein and calcium, and it's an easy way, I guess, to get a lot of those nutrients that we need in our diet. That's kind of why it's been a cornerstone of Western diets for a long time. Cow's milk is generally, it's naturally a better source of calcium, but like I said, because most soy milks are fortified now with calcium, they're a really decent substitute for cow's milk. Soy milk's a good source of protein, and soy products, should be a good part of a kind of healthy, balanced diet.
What about fats, comparing milk with milk?
Yeah, so soy milk is it doesn't have, the same, it's lower in fat, it's lower in saturated fat, but milk products generally are fairly low fat. And I guess if you're concerned about the fat content, you've got kind of skim milk as an option, but that is something, I guess, to take into consideration, that yes, soy milk is lower in fat content.
So soy is also lower in fat, but as I think you mentioned, it's fortified, so along with the natural qualities of soy itself. So you've got iron and fibre, other vitamins and minerals. So is there a kind of recommended blend between dairy and soy in your diet?
Look, I think it's really personal choice. Like, soy is definitely the best kind of substitute for cow's milk. If you're going to not have regular cow's milk in your diet, then soy would certainly be the best option, in contrast to other plant-based milks like those almond milks. Yeah, absolutely. Okay, by a long shot.
Well, we'll go back to some of those other milk alternatives in a moment, because a lot of people are opting for those too over soy and dairy. But just back to Mel's original question, she was asking, is soy milk messing with our hormones? And what's the science saying there?
Yeah, so people are a little concerned. There was concern some years ago about this. So soy products contain these things called phytoestrogens, and they're kind of naturally occurring plant chemicals that are chemically pretty similar to the body's natural estrogen, but, they're of a much weaker scale. And soy is not the only food to contain them, but it does have a high concentration of them. And so I guess the discovery of phytoestrogens in soy products led to concerns that they would kind of mimic the effects of our body's own natural estrogen and potentially disrupt our hormones. And there was a particular concern that was raised some years ago when researchers found basically that these phytoestrogens could increase the risk of cancer in rats. But it's very important to point out that animals, rats have a very different metabolism to humans, and studies in humans do not point to any kind of harmful effects.